Hi, my name is Jennifer Smith. I'm a licensed clinical social worker with Wayne Health Psychiatric Services. Post-traumatic stress disorder is an anxiety disorder that a lot of people suffer from after they've been exposed to a traumatic event. That anxiety disorder can be linked to natural disasters, car accidents, victims of physical or sexual abuse. It's natural to have some symptoms of PTSD shortly after a traumatic event. However, it's usually diagnosed when the symptoms of post-traumatic stress disorder go on for greater than a 1-month time period. The symptoms of post-traumatic stress disorder usually exhibit themselves in ways like hypervigilance. The person goes out in public and they're overly aware of their surroundings, oftentimes avoiding going out in public, period. They avoid any type situation that reminds them of the trauma that they experienced. Oftentimes the person has co-occurring symptoms of depression, anxiety. The patient may be experiencing panic attacks. We see a lot of substance abuse that goes hand in hand with post-traumatic stress disorder. Oftentimes patients are in need of both talk therapy and medication management. Talk therapy utilizes usually two basic types of therapy, which is cognitive behavioral therapy. That helps me help the patient learn to revisit memories related to the trauma and deal with those thoughts in a healthier way. We also use exposure therapy. In exposure therapy, we work with the patient on being able to handle anxiety, and then we slowly try to reintegrate that patient into those situations that trigger anxiety and memories and help them better cope with that situation and kind of build confidence that every situation is not as traumatic as they tend to believe after they experience something life-threatening. It's very rewarding to see a patient that can regain control of their life and can integrate back into their social circles and with family and friends. A lot of people who suffer from traumatic events tend to feel like nobody understands, especially if they've been through a sexual assault or physical assault. They tend to grasp the concept that, well, nobody understands how I feel, nobody can help me, and they feel very alone. However, there's so many people that suffer from this disorder for such different reasons, and treatment is very effective, and there are people that understand. I would encourage patients who feel like they're suffering from any of the symptoms of PTSD to contact our office, Wayne Health Psychiatric Services, visit their local primary care physician. They can also help link the patient with resources in the community that can help with those disorders. I just want people to know that are suffering from this disorder that life can get better. They can regain control. They can begin to live again.